What is bipolar disorder? Bipolar disorder is also known as manic depressive illness. In this disorder, there are extreme shifts in moods, visible changes in physical activity, energy levels, and daily routine activities. Usually, the shift is between extremely high energy levels and low energy levels. The periods of high energy levels are known as manic episodes, whereas the periods of low energy levels are termed as depressive episodes. Bipolar disorder is common in both men and women, but in women, rapid mood swings are more significant. About 50% of total bipolar disorder cases happen before the age of 25 years. Some people have their first incidents in childhood. Let us have a look at how a person may feel or think. When an individual is in manic episodes, he may feel himself the richest man on the planet with a feeling that he can do everything. When he is in a depressive episode, he thinks he is a poor guy and soon he will die because he is a criminal too. In other words, some psychotic symptoms like hallucinations, superstitions, and delusions are also observed in patients. In manic episodes, there is a trouble sleeping. A person feels highly energetic and their thought process is up. They may become very agitated and touchy without any reason. There is an increased sex drive during manic episodes. Taking a risk and doing adventurous activities appeals to a manic person. In depressive episodes, an individual feels very lazy and tired. He seems to be lost and angry. In this depressive state, he thinks himself useless and his mind is full of suicidal thoughts. The signs and symptoms are very clear in bipolar disorder. You may observe severely changing patterns of emotions, behavior, sleep, and activity. A person who is going through this bipolar disorder thinks himself as normal, but their family and friends confirm changed behaviors. There are 4 types of bipolar disorder. The first type is a bipolar 1 disorder, and it is a mixture of both manic and depressive episodes. In this manic episode, it lasts for 7 days, while depressive episodes last for 2 weeks. The second type is bipolar 2 disorder. It is a combination of depressive and hypomaniac episodes. Hypomaniac means a person is less energetic as compared to its manic episode. This type is more significant in females as compared to the male population. In the cyclothymic disorder, that is the third type of bipolar disorder, a person may have spent a past year in a depressive or manic episode during their teen or adolescent years. Other bipolar disorders also exist that do not match the above-mentioned 3 types, so those reported cases accomplish type 4. In bipolar disorder, mood episodes are very prominent. The usual behavior of an individual drastically changes from a predictable one. There may be some underlying complications that may result in this disorder. Attention deficit persons with anxiety and substance abuse are at a higher risk of developing this disease. Surrounding environment and genetics also play a crucial role in determining the risk factor. Bipolar disorder is a lifelong illness. However, treatment may help a person get control of their emotions and mood swings. It is a repetitive disorder. A person keeps going on, shifting between manic and depressive episodes. Proper medication, attention, and having a healthy conversation can be an effective therapy for treatment. In bipolar disorder, some individuals are free of mood swings, but they still show other signs and symptoms. An omega-rich diet, for example fish, eggs, nuts, and seeds, shows betterment in persons during depressive episodes, but results are not positive for manic episodes.